everybody? Today we're talking all about C-sections. If you follow me on Instagram, then you would have seen my post that I put up a couple of days ago about the new provisional data that the CDC dropped about the new data from last year's births. So for this video, we're going to be going a little bit more in depth, giving a little bit more nuance behind these numbers, and let's talk about why it could be troubling. What's up, everybody? For those of y'all who don't know me, my name is Jamila Bell. I'm a labor doula and lactation specialist here in Atlanta, Georgia, and this YouTube channel is all about pregnancy, labor, and delivery. So if you're somebody who's interested in that topic or know somebody who is, be sure to like, comment, and subscribe. Now let's get into the video. So the CDC reported that C-sections have gone up for the third time in a row, from 32.1% to 32.2%. Now, it's important to note that the World Health Organization suggests that countries do not go over between 10 and 15%. So as you can see, we're double that number. And if you break it down by demographic, you see that Black women have an even higher rate than the national average at 36.8%. That is an issue. So in my comments, I got a couple of people wondering, well, why is this an issue? The rate has gone down overall since 2009. Who cares? I had a C-section and it was fine. I had 3 C-sections. I've been okay. What's the big deal? If you want a C-section, you go have a C-section. So that kind of frustrates me because in the video, I'm simply expressing the data. All I'm saying is this is what's happening. These are the numbers. What do you guys think? Here's the issue with that number and why we as birth workers want that number to go down. It's important that we recognize pregnancy as a natural occurrence. It's not a medical issue. Being pregnant is not something that needs to be treated. It's something that should be assisted. Labor should be assisted. It should not be treated like a medical condition. Of course, there's a caveat within this conversation. And for some reason, people think that I'm just not aware of the caveats when we're talking about C-sections. So let's go ahead and talk about it. Emergency situations. There are situations, there are complications that can occur during labor where a C-section is non-negotiable. You need one to save you and or your baby's life. I am not trying to get rid of C-sections. Nobody is trying to get rid of C-sections. C-sections should be used as a fail-safe, a means of emergency evacuation of that baby. As we see it now, we see that C-sections are becoming more and more elective as we go forth. The issue with that is we have to make sure we understand that a C-section is major abdominal surgery. It's not something as simple as, oh, we're just slicing the baby out. Like, there's very serious complications that can come with having a C-section, and there are a lot of risks, as any major surgery would have risk. That's the reason we want these numbers to go down. The more interventions you have during labor, the more complications and risk you're available to. We, as birth workers, want you to walk out of that hospital alive with your baby. That's not to say that if you have a C-section, you and your baby's gonna die. That's not to say that at all. It's just to say that having a C-section increases your risk and complication rates. And when we're looking at the maternal mortality rate, specifically within Black women, we know that they have a higher C-section rate. We know that they are dying 3 to 5 times more than white women. We, as Black birth workers, want our Black women to get less and less interventions, not just because we want to sit here and control their birthing environment, but we want to bring down that number. Black women are dying, and that shouldn't happen. There are a host of complications that can happen during labor and delivery that are unfortunately not preventable and not predictable. And in that case scenario, we need to act fast and do what we can to save both mommy and baby, 100%. But in a lot of cases, what we see are medical providers pushing on this idea that you've been laboring for a long time, you need a C-section. And that's not always true. Labor is long, labor is persistent. That is how it's supposed to go. As long as you and or baby do not have major complications throughout your labor, you should not be getting a C-section. And that shouldn't be a controversial statement. I understand that some women feel as though, well, I had a C-section and everything went well, so I don't know why people are talking down on C-sections. I'm not talking down on C-sections at all. C-sections are necessary. We need to have that as a viable option in case something goes wrong. But your doctor should not be pushing you to have a C-section if you don't need one. And that's the issue. A lot of OBs are not trained on vaginal deliveries. So if you're not trained on vaginal vaginal deliveries and you don't have a lot of experience being with a patient throughout the duration of their vaginal delivery, you're going to be more inclined to introduce interventions. Let me use myself as an example. My son was faced OP, which basically means he was facing face side up instead of face side down. Face side down is optimal pushing position. He was sunny side up is what they call it. Because of that, the positioning of his head and my pelvis was a little obstructed. It took me a little longer to push him out. As I was pushing, a doctor came in without my consent. A male doctor came into my room without my consent and started to prep me for a C-section, again, without my consent. I had to vocalize right then and there, I am not having a C-section. There is nothing wrong with my child. There is nothing wrong with me. I can see that he is almost out here. I'm going to keep pushing until I get him out. And if it wasn't for me being vocal and making sure that I knew how informed consent worked, I guarantee you I would have been pushed into getting a C-section because they were already prepping the room for me. That is how quickly women get pushed into going into C-sections, because it's very difficult to push back against medical staff when you don't know any better. Like I said, there are cases in which C-sections are 100% necessary and needed, and I would never ever steer my client away from getting a necessary and needed C-section. Pushing for a long time, being in labor for a long time is not a reason to get a C-section. Everything requires nuance, careful care. There's not a one-size-fits-all plan when it comes to labor and delivery. Another issue with these numbers going up is money. Who the hell is trying to pay all this money to have a baby? Look at your itemized bill for when you have a vaginal delivery. Now go ahead and double it. We should not be paying all this money. Now, there's another conversation that needs to be happening with universal health care, but we're not going to go there right now. we're gonna save that for a different video. But it's a lot more money. There's a lot more risk. There's a lot more liability that occurs. The other side of that is postpartum. Oh my goodness. Postpartum hemorrhaging is the #1 reason that women are dying during child labor. When you have a C-section, your chances of having a postpartum hemorrhage goes up. Knowing all of that, and also knowing that Black women have the highest rates of C-sections, what do you think is going on? Exactly. Black women are at higher risk of death because we're at higher risk of having C-sections. So what can we do? How do we get these rates to come down? Is this something that we can even change? Absolutely. So here are a couple of things that I would suggest that we all can do without talking about legislation, because of course that takes time. #1, I implore everybody to hire a doula. I know because I'm a doula that seems like a money grab and a business venture, but it's real. There are doulas that do pro bono work. There are tons of grants out there for you to help afford a doula services. Talk to your doula about affordable services. Ask them if they can bring their rates down. Shop around. There are doulas out there that are absolutely affordable. Do what you can. Everybody needs a doula. I don't care if this is your first, second, 10th pregnancy, get a doula. The second thing I want you guys to do is understand the real risk factors that'll cause you to have a C-section. Laboring for a long time is not a reason to have a C-section. You've been pushing for a while, not necessarily a reason to have a C-section. Understand what risk factors mean that you absolutely need to go, and understand the difference. Get informed consent. What does this mean? This means asking questions. If your doctor comes in while you're pushing and they say, all right, we're gonna have to go ahead and give you a C-section, ask them why. Ask them if it's medically necessary. Ask them if you are in a medical emergency. They cannot lie to you. They have to tell you the truth. If they say, oh, you've been pushing for a long time, so it's best we give you a C-section, ask them, is this putting me at risk right now? Is my baby in danger right now? How long do I have until that clock starts? What can I do to avoid getting a C-section? Ask these questions so that you can have informed consent about if, when, and how you'll need a C-section. Before you get to the hospital, before you even go into labor, when you're going to those prenatal visits, ask your medical provider, what is the C-section rate of my hospital? And last but not least, you need somebody in there to help advocate for you. I understand everybody does not have the same support system, but you need to find somebody in your life that you trust to be in that room with you. Giving birth by yourself is a no-no. I don't care what nobody tell you. You can't do it alone. Yes, our bodies are miraculous and we can do all things. Absolutely. But you need somebody there to help support you and, most importantly, advocate for you. I hope this video gave you a little bit more nuance and information about why these C-section rates going up is a little bit scary. And let me just say this before y'all get crazy in these comments. I don't want to get rid of C-sections. They're necessary for emergency situations. I want the number to go down. I don't want to eliminate them because I recognize that sometimes you need a C-section to save you and your baby's life. Thirdly, if you have had a C-section, shout out to you. This video is not to shame you for having a C-section. I recognize that there is an array of different reasons why somebody needs to have a C-section. You having that baby is 100% still valid. You are valid as a mother. I don't want anybody to make you feel as though because you did not have your baby vaginally that you are any less of a mother or you did anything less. You absolutely did what the fuck you need to do. You got your belly cut open. Girl, shout out to you and that baby. Thank you guys so much for watching this video. If you want to see more, be sure to subscribe and make sure you guys are following me on TikTok as well as Instagram for more up-to-date daily videos. Thank you guys so much, and I'll see you next week.